Hospital and Midcoast Hospital. So today, what I wanted to do with you guys is just get you acquainted with the foot anatomy, which means the structure of the foot, understand some common conditions of the foot, some preventative measures that you guys can start doing, every day to kind of minimize your problems. And then I was just going to touch on diabetes, because diabetes is a growing problem, and I know we have some diabetics here with us today, and we want to make sure that you guys are all squared away from a diabetic standpoint, and answer any questions, okay? So, the foot is complex. 26 bones in the foot, plus or minus, 33 joints, 107 ligaments. Did you know that 25% of the skeleton is in your foot? It's a lot, right? 25%. So the foot is sometimes a mirror image of one's health, so they say. The functional demand on the foot is high. Humans place 2 to 5 times body weight per unit area during the walking cycle. So we all know how much we weigh, kind of, sort of. 2 times body weight at a minimum go on the foot with each step. A lot of demand. 8 to 10,000 steps a day. How many times do you think who's the senior here? Who's the winner? Do we have anyone approaching the 100-year mark or 90-year mark or?
Oh yeah.
She's approaching, she is.
How old are you?
In January I'll be 90.
All right, God bless you. Now, how many times do you think you walked around the earth in your lifetime?
Oh, I have no idea.
4 times, maybe more. If you think about that, that's amazing. That thought. Walking around the entire earth 4 times over the course of our lifetime. That's why I named the lecture The Long Walk. It is a long walk, right? Look at that guy walking. See him? Boom, 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 boom. See the little monkey? You're missing it. Got the little monkey in the corner. All right, so here's the crux of it, guys and girls, and I'm sure you're aware of this. Guess what? The foot changes as you age. Does everyone agree? Yes. All right, so don't be surprised if your foot gets longer and wider as you age. That's part of God's plan, okay? That's how we get more stability, longer and wider. Don't be surprised if the fat pad on the bottom of your foot moves into your stomach, okay? That's another part of the plan. So we lose the fat pad as we get older, okay, in the foot. And we lose the cushion. And don't be surprised if you get some bumps, lumps, and different types of things in the foot in different areas as time goes on. These are all things that we should be expecting, okay? Not a surprise. So what can you guys do to kind of minimize your future problems? What do you do? Well, I remember my grandfather. My grandfather lived to 99. I thought that was pretty good, because he was good till about 96. You might beat him. You look like you're in good shape over there. So, I got big plans for you. I think you're going for the gusto. But stay active. Keep moving. My grandfather had a whole regiment that he did every morning and every night with his hands, his feet, his legs, and we were laughing, I was like looking at him as a kid and I'm laughing, it was like, doing these exercises that he self-created, but I get it. I understand now why he did that, because, in my 40s, I'm starting to say, after I work with my hands all day or do something, I wake up the next morning and go, wow, my hands are getting stiff, what the hell is going on here? So, keep moving. Stay active. Stretching twice a day. As far as the foot goes, the stretching is pretty simple. I don't have to give you guys a big complex stretching thing. Simple. Before you get out of bed, throw a tennis ball at the foot of the bed and gently massage the bottom of the foot and roll on that, okay? Twice a day before you wake up in the morning and then maybe before you go to bed. And some simple Achilles tendon stretching. Achilles tendon stretching is relatively simple. You can put a simple towel around your foot and pull the forefoot or the area where the toes are to you. Or you can do the classic track star stretch that we used to do years ago, where you kind of do this stretch. Remember that maybe from gym class circa years ago? Okay? No?
Didn't have gym class
Okay,
years ago.
very good. Yeah, they got rid of it now too, so. The other stretch is taking the foot and going up on one step or stair and putting half the foot on the foot and letting the heel drop down gently and not bounce.
I just did that this morning.
Very good. Okay, so these are all good stretches to do twice a day. Making good decisions with your shoe choices is important, okay? You can start bringing on a lot of symptoms by making the wrong shoe choice. We all know that, okay? I've done it myself, okay? So, you know, Lamy Williham's and some of these other stores still have a shoe salesman. Of course, the price comes along with it, but, you know, certainly, you know, getting some appropriate shoe sizing is important. If you buy shoes, don't wear them outside. You know, keep them at home, wear them inside for a check, and if they're not good, put them back in the box and take them back. Okay, that's legal to do. Now, if you wear them and you go trouncing around in the mud and you go back, they're going to say, screw you, you know, we're not giving you the money back, right? So, don't feel shy by putting them on and sitting in the store for a half hour and really feeling and making sure your feet are good, all right? And moisturizing your feet as we get older, the skin gets drier, especially in the in Maine. You know, we have cold weather and our skin doesn't get as nutritionalized as we get older. And you do have to use some external things like moisturizing creams to help keep the feet smooth and soft. And most importantly, if you get a foot problem, you know, try not to neglect it and get it checked out instead of just thinking it'll go away. So, some common conditions, we're just going to look at fungal nails, ingrown nails, hammer toes, aromas, heel pain, bunion pain, and arthritis. So, fungal nails. Look at that. Oh, you like that? That's a sound effect. Right in here, this nail is thick, distorted, and that is what a fungal nail looks like, okay? That is rubbing into the neighbor, and that can create a sore there. Here is another example of fungal nails. See that? So this could be a problem. Yeah. If you have this, it could be fixed. The treatment could be a pill if your liver is in good shape. It could be removing the nail and making it so it never grows again. It could be trying something topical to paint on, or simply cutting back the nail every now and then to keep it well groomed out. Okay? These are all options. Any questions on fungal nails? This is someone that had the pill, see? And you can see that it's coming out clear right here. And this part back is clear, and it's growing out. That's what happens when you take the pill. It takes about a year, but the nail does 77% of the time come out clean. Ingrown nails, it's a little less visible here. We don't have enough light, but this is infected. If you get an ingrown nail, you gotta have it fixed. You can't have a ripping infection for the rest of your life. I do that. Here's an example of ingrown nails. See, that's infected, right? That's someone that cut their nail back into the quick when they shouldn't have. Okay? And the fix is relatively simple. All right, how do you like that toe? See it? That is what we call a hammer toe. Hammer toes can occur at any level, and really, the take-home message is what causes a hammer toe? Muscle imbalance. Here's a toe, it's nice and straight, everything's in balance. Here's a hammer toe. I'm pulling harder and longer on the stuff on the bottom. See it? The longer we're in the game, the more opportunity we have to get a hammer toe. Okay? It's common. Whoa, look at that, it went back. It's common, and you either wear a soft shoe and protect the toe. That's the conservative treatment. Or if that doesn't work and you wear a soft shoe and toe protection and everything of that nature, sometimes we do surgery on the toe to fix it. We just straighten it right out. And then we usually will freeze the toe straight. So now we're a crooked one and we froze it. If you ever get pain in the ball of your foot, okay, it's probably a neuroma. It's an irritated nerve in the ball of the foot. I'm giving you guys like the most common thing we see. You know, so if you're, I had a neuroma, which is pain in the ball of your foot. Okay, and really what it is an aggravated nerve. So the treatment really is based on de-aggravating the nerve. So we usually give a cortisone shot and it makes it go away. In some few patients that it doesn't get better, we remove the nerve. And this is an example of one that's really thick and scarified. So that person didn't respond and didn't want to bring a lot of aggressive pictures for you to see, but I thought, what the heck? You guys like seeing stuff anyway. All right, here is the mother of all foot problems. Heel pain, plantar fasciitis. If I were a betting man, I would say that like 80% of you had heel pain at some point in time in your life.
I did.
You did.
Heel spur.
Heel spur.
And you took care of it.
I took care of it. Oh, that's good. See, that's good. I'm helping someone anyway. So heel spur, plantar fasciitis, plantar fasciosis is all the same stuff. Basically, there's this piece of tissue on the bottom of your foot called fascia, and for whatever reason, it gets stretched out to the extreme. When it does, you get heel pain, and it's hard to get rid of, okay? Usually, it'll require treatment. And again, it might come about just by virtue of age, because the foot changes as we age, and this band of tissue does not change, okay? And it's really caused by mechanical causation, okay, which means, you know, it's getting stretched out to the extreme and getting inflamed. Treatment is a structured approach of stretching. There's a picture of that stretch where you roll on a tennis ball, see? And Achilles tendon stretch. That was that one I was telling you where you go up on one step or stair and the heels drops down. Sometimes we use night splints to help. Sometimes we put you in physical therapy. Sometimes we'll tell you to roll on a frozen plastic water bottle. So you get a plastic water bottle filled with water and turn it into an ice cylinder and roll on that instead of the tennis ball. Sometimes you can take Advil, the ibuprofen, if there's no contraindication. Some of you guys can't take that, and you know who you are. Injections of cortisone. Ouch.
Yeah.
But it works. I had one. My wife had one. You have one?
I had 3.
Yeah.
And it didn't work.
Okay. Well, it doesn't work for everyone. That's why we got to go further. Inserts, structured shoes, taping, orthotics or inserts in the shoe. So all of this stuff helps with plantar fasciitis. Sometimes it doesn't help, and we have to do a surgery. And in this surgery, we identify where that thing attaches, right there, and then we put this little cannula in there, and a little knife, and we cut the thing. Okay? And that's me doing a picture of that, just lengthening the band of tissue, and that works